My name is Dr. Dustin French. I'm a professor of ophthalmology and medical social science at Northwestern Medicine, and I am the principal investigator of a 5-year National Eye Institute-funded study titled Health Equity for Leveraging Technology and Access for Diabetic Retinopathy. We're fortunate that we're funded for over $3 million to support the research initiative at Northwestern Medicine and across 34 other academic sites throughout the United States. HEAL-DR deals with the issues of diabetic retinopathy and optical coherence tomography. And the goal is to assess the overall risk of high-risk populations, particularly African American and Hispanic and Asian populations that are most likely to suffer the consequences of diabetes and diabetic retinopathy for visual impairment. So this study fulfills the need and the gap where minorities have largely been understudied in clinical trials that guide how we treat patients. While the majority of patients treated in our program of medicine are African American, the clinical guidelines have been developed predominantly on white patients. There's over a threefold difference for vision-threatening diabetic retinopathy among African Americans compared to whites. Understanding what drives these factors will help us to personalize medicine for those at the highest risk of this visual impairment and blinding condition. So we use a transdisciplinary approach. We have a very diverse team. They include Dr. Jeremy Levine, who is a retina specialist, Dr. Paul Breyer, a pathologist, Dr. Charles Neek-Evan, an epidemiologist, and Dr. Abel Coe, an informaticist. So our team uses a diverse set of data including optical coherence tomography, laboratory, vital data, and the social determinants of health can ultimately impact their visual outcomes. In addition to that, we use statistical techniques that have been commonly used in risk assessment, artificial intelligence, to better personalize medicine for the ones who are the most vulnerable. Our study utilizes SOURCE as a key data component, which is very different than the traditional randomized controlled trial approach, which has under-enrolled minority patients. With SOURCE, we're able to proactively look at the data and the frontline treatment of our patients as it comes in through our system to custom tailor treatment for patients with the outcomes and the products of this study. As the technology and the medical landscape changes, we're able to be very nimble with the data that we can then study without major project modifications. This opportunity allows us to turn the page on a devastating disease that has been largely understudied in minority populations and to come up with practical solutions that can be custom tailored to the individual patient rather than a one-size-fits-all approach.